Yeah, so let me be clear. I would say this is absolutely not the time to do that. It's too early. So if you consider how many people have been infected, which probably in the 15 to 20%, we're waiting on some prevalence studies, probably 15 to 20%, we've got a tiny amount of vaccine, which means there's still a huge portion of the population which is still susceptible to becoming infected. And I just told you a couple minutes ago that we now know that there is a fair amount of UK variant in the community. So no, this would not be a good time to do that. I hope that the governor will consider differently. Even if you listen to the CDC and Dr. Fauci and others, there is considerable talk that we may be looking at another wave come in April. So if we want another wave, then you should do those things. But nobody wants another wave. So I would recommend that the governor not reconsider that position. And one other thing that was very good, just so people know, to Director Williams' point about, the sensitivities about the Johnson & Johnson vaccine, I may also be clear, in my opinion, the best vaccine you can get is the one that you can get. All right? The Johnson & Johnson vaccine is highly effective, but it's being compared to the Pfizer and Moderna, which are just way more effective than people had ever anticipated, in the 90% range. That's just way higher than anyone had ever been expected. So now as we're looking at Johnson & Johnson, which is in this, the 75% range effectiveness, that is a very, very effective vaccine. So let's not get our standards messed up because Pfizer and Moderna just happen to be so powerful. The Johnson & Johnson vaccine is an excellent vaccine, and if you can get it, you should.
And any vaccine that'll keep you out the hospital and keep you alive is worth getting. So don't hesitate. And then let me I wanted you to hear from Dr. Peirce before I answer that, because I don't want enough of the making it political. But this is not the time to take the mask down. Okay, quite frankly, it's just like I reported over 700 new cases of this virus today and 7 new deaths. These numbers are real. These numbers are real. And it's only to the point where we are saying no person has died, and you're into the single digits. But I remember in the last week in April of 2020 when we reduced the standards. And I remember in May, June, July, and August when the numbers went up. I remember in the late fall when the state reduced the standards, and then the numbers went up again. Okay, so this is not the time to be saying people don't have to wear masks. That we want to lower the standards. It's one thing to ease up on some of the standards in a methodical, deliberate fashion. I got that. But my main concern would be taking these masks off or saying you don't have to wear the mask. I think we can ease the standards in other areas. As I look to ease some of the standards later on this month in March when it comes to Little Leagues playing baseball, things of that nature, some of our parks and recreational facilities. But I do encourage people to keep these masks on. Okay? So feel very strongly about that.